Healthcare services are created with the patients in mind, right? Would your perspective change if you had limited mobility, couldn't hear properly, had restricted vision? That's what many seniors experience every day. The aging suit mimics aging so healthcare providers can walk a mile in the shoes of many of their patients. Experiencing Aging was created to get a glimpse of how we can improve healthcare experiences for the aging patients and their family caregivers. Let's take a look at primary care. As people age, they count on their primary care provider to help them understand and deal with the health challenges they face. Unfortunately, the very age-related health issues that seniors face can make their visit to their primary care providers difficult and confusing. To get a clearer picture, we've simulated a visit to a doctor's office by a typical senior. Meet Lou. He's been having dizzy spells, so he calls his doctor's office to make an appointment. After a long wait, he finds it difficult to understand the receptionist because of his hearing loss. Lou arranges specialized public transportation for his appointment the next day. The driver drops him off and brings him to the waiting room and hurries to his next pickup. After some time, Lou is worried that he hasn't been called yet, so he joins the slow-moving line to speak to the receptionist. Lou's arthritis makes it uncomfortable to stand for a long time. Once he's at the front of the line, he has difficulty communicating with the receptionist through the thick glass. He feels rushed and has to speak loudly. He's embarrassed with so many people listening and waiting in line behind him. Lou heads back to the waiting area. The space is cramped and he's having difficulty moving about with his walker. With his hearing loss, Lou has an especially difficult time hearing in noisy environments, and he doesn't realize his name has been called. Lou finally makes it to the exam room, where he waits for the doctor to arrive. His pickup is soon, and he's worried that if he's not ready, they will leave without him. The doctor arrives, and Lou describes his symptoms. He mentions a recent visit to the hospital, which the doctor wasn't aware of. The doctor needs to get in contact with the hospital to get the report. Now Lou is really in danger of missing his ride. As the doctor refers him to a specialist, Lou remembers a recent fall where he bumped his head. Could that be related? There's no time. His ride is going to be there in any minute. Maybe he'll mention that next time, if the dizzy spells don't clear up. Other challenges seniors face are centered around the physical and mobility limitations that can come with age. In order to experience these limitations firsthand, Kavita Mehta, Executive Director at the Southeast Toronto Family Health Team, has volunteered to experience a simulated primary care visit while wearing the aging suit. The aging suit simulates many of the physical and sensory challenges connected to aging, chronic health conditions, and disability. It uses braces to limit joint movement, goggles and earplugs to reduce eyesight and hearing, and special gloves to decrease sensitivity to touch. Kavita wore the suit in a simulated environment as a learning opportunity to identify some of the barriers the elderly face in accessing healthcare. We pick up Kavita's visit to primary care as she fills out a questionnaire in the reception area.
Reading the form in the waiting room with those goggles on, which occluded my vision, which made everything blurry, made the font size so small, and it probably was already small, was unbelievably difficult. Not having that peripheral vision made it even worse.
Larger text that contrasts more with the sheet it's printed on will be a big help to those with impaired vision.
There was no one there to actually talk, and if you wanted to talk to somebody, you had to get up, stand in a line just to get your questions answered. So getting up to join the line when I was in the waiting room was painful, because actually when you're sitting down, it's not so bad, but actually getting up, you felt all these aches and pains in your joints. And then having the stooped posture and trying to walk when you have occluded vision and can't really see that well in front of you just made it even more difficult. But I did not expect that much joint pain, and that's where a lot of the pain was actually happening in the knees and the elbows.
Many seniors cannot comfortably stand for more than a few minutes. These mobility issues can also affect them once they've made it into the exam room.
Getting on the exam table was extremely uncomfortable. It made you feel vulnerable. I didn't realize how much I relied on a crutch to actually help me even balance myself. It was not a comfortable feeling to be in, and I felt my weight on that cane, and you just kept thinking, oh my God, what if it was a slippery floor and then the cane went and you'd go? And being in a room by myself, opportunity for a disaster happening.
Providing a step stool, stability aid, or lowering the exam table can all help make this less difficult and safer. Kavita's and Lou's experiences reveal just some opportunities that might help us serve elderly patients more effectively. It's important to reflect on the processes and practices in your own organization to identify opportunities to improve patient experience. For example, staff can ensure elderly patients have easy access to their mobility aids and know where the washroom is while in the waiting room. When it's time to move to an exam room, going directly over to elderly patients to let them know might be better than relying on being heard in a busy environment. Making sure seniors don't feel rushed during different stages of their visit can help facilitate better care. Seniors face many challenges in accessing primary care, but if we make an effort to understand how their experience might differ from that of younger patients, we can find solutions that result in less frustration and better health outcomes. Many healthcare organizations are already addressing these and other challenges, but it's important to take action system-wide. If we make an effort to understand the experiences of seniors, we can find solutions that result in less frustration and lead to better health outcomes.
Oh, thank you.
Oh, you're welcome.
Thank you very much.
To do your own reality check or to learn more, visit experiencingaging.ca.